Have you ever got that EOB in the mail that says, this is not a bill, and just thrown it away because it's not a bill? I have. Well, I'm gonna tell you why you shouldn't do that in this episode of Healthcare Hacks. How many of you have got a bill that says you owe $80 or $100 and just paid it? Don't do that. I've done it, don't do it. A lot of times you have to ask for what we call an itemized bill. They'll tell you exactly what services are provided, what the charges were, what the insurance company paid or didn't pay, and then what you're responsible for. Make sure you get that before you pay a bill. The next step, which most people don't do, but I highly recommend, is you compare it with the EOB that your insurance company gives you. Again, that's the thing that says this is not a bill. It should have what the charges were for your service, what the contracted rate was for your insurance company, because insurance companies don't pay charges, they have separate contracts with their provider, and then what you're responsible for. Just compare what the insurance company says you're responsible for with what the hospital says you owe. If those two numbers don't match, you got a problem. You need to talk to the doctor and say, look, I've got an EOB that says I owe $80, you're charging me $100, why is that? Another easy way to protect yourself is if you ever get a bill from a hospital and it says charges were $100, nothing for the insurance, it says you owe $100, there's something wrong with that bill. Every insurance company has, if it's an in-network provider, has contracts where they have discounts to the service. Hospitals make mistakes, insurance companies make mistakes, but you can protect yourself by taking a little bit of time, comparing those numbers, making sure that they match, and making sure that your insurance company's discounts have been applied. A lot of times, no one's going to tell you that a mistake was made. The only person checking is you. If you have questions about how to save money or problems you're facing with healthcare dollars, email us on the address on the screen.